Joining us today on the show is Dr. David Klein of the Stages of Life Institute in Longwood. It's a very close drive for you. I tell you what, very, very nice ride if you know the route. But if you head out on Highway 42 and you cross Eustis and then you get down on 46, you've got it made. You're there in no time. It's less than an hour from the villages and, of course, points down to Mount Dora. But today the doctor wanted to talk about something that everybody in this audience has or is suffering from. And that's a general statement, but it's true. Headaches. Doctor, what starts a headache and how can we get rid of it?
Well, the first problem, given the fact that headache is one of the singularly most common complaints that brings anybody to the doctor's office, what's more, it's one of the main complaints that makes people not show up to work or diminishes their capacity to work. So the better question is, what's a headache? And what causes it? Because you don't have a prayer of fixing anything. You don't have a clue as to what to do unless you know precisely what's going on. Now, what is a headache? Like I say, well, simply stated, it's pain someplace from your chin up or from your neck up. Okay, so it could entail many different structures. Each one of them can cause a headache. Each one of them has a different signature. Now, why is this important to you? Because a migraine, everyone goes, well, I got a migraine. Okay, what's a migraine? Well, it's a severe headache. No, it's not a severe headache. Migraine does not imply severity. If you have a severe headache, it's not necessarily a migraine, and a migraine doesn't necessarily have any headache attached to it one bit. You can have vascular migraine. You can have abdominal migraine. You can have a migraine where it's just abdominal discomfort. You can have acephalgic migraine. What is that? That's migraine without headache. Okay, so a migraine doesn't necessarily mean headache, and headache doesn't necessarily mean migraine. So what are the different structures? What are the different possibilities that can be causing your headache, your daughter, your son, your husband, your grandparents, for God's sake, or anybody else's headache for that matter? And the first thing you have to do is to look at things objectively and get a good history. Look for precipitating factors and coincidental factors. And this sometimes takes a little bit of work. In fact, it frequently takes a lot of work because if you already have the answer, you've already got a solution set. So it's by definition going to be cryptogenic, or it is going to be of a cause that's not clearly obvious or discernible at this time. Not to say that you can't figure it out. So let's start with the most common of all headaches here in Florida, and that would be sinus. Okay, sinus headaches are extraordinarily common, and they can be severe. They can be incapacitating. They can be miserable. They can trigger migraines, but they're not migraines by themselves. So the most common of all sinus headaches involve something called the maxillary sinus. These are the sinuses in the front of your face. Now, when they get clogged up, they don't drain. Happens very, very frequently in the summertime because of the drop in barometric pressure. So if you see rain coming through, you know that the barometer is falling. That tends to trigger these sorts of headaches. So what can you do about it? Well, the first thing you have to do is make sure that this is the diagnosis. Why does it hurt in your eye? Why does it hurt in your teeth? If it doesn't hurt in your eye or your tooth, then it may or may not be necessarily maxillary sinusitis. Why is that the case? Okay, there's a branch of the trigeminal nerve that passes directly through the maxillary sinus. And when that sinus gets irritated, inflamed, or angry, it tends to cause eye pain and dental pain. End of discussion. Okay, how do you fix it? You drain it. Very, very simple. You thin out the maxillary sinus secretions, and then you propel them. You just push them out of the maxillary sinus by using something as simple as peppermint oil. You apply peppermint oil under the eye, not close to the eye, but under it on the cheek, or inside the mouth over the hard palate. I have people put peppermint oil on their thumb, apply it to the roof of their mouth, and guess what? It stimulates the sinus to drain outward. You never want to push the secretions inward with a neti pot. That's a guaranteed for getting infection at some point. It ends badly. If not now, it will in several years. What other causes of headache are you likely to endure? Well, the second most common is going to be stress headache due to entrapment of a nerve called the greater occipital. And this generally involves the musculature at the base of the skull pinching a nerve in what's called the posterior triangle, and it goes over the top of the head and behind the eye. And it mimics migraine like crazy. Why? Because my eye hurts. My face hurts. I've got blurring of the vision. It must be migraine. Not usually. More times than not, it's greater occipital neuralgia, and the treatment is very, very different. Anti-inflammatories, muscle relaxants, topical anti-inflammatories settle it right down. Very easy. The diagnosis is made generally by using the topicals. Goes away in 5 minutes. You know exactly what you've got. Now, why is this important? Because if you can't discern a greater occipital nerve pain from migraine, you don't have a prayer of fixing it. What's more, and probably more important to more and more people these days, is that the treatment of true migraine is expensive. Those little tablets can cost $30 to $50 a pop. Sometimes just $10 or $15. But any way you cut it, okay, it's a lot of money to treat a real migraine. So if it isn't a real migraine, why would you necessarily want to go ahead and get Imitrex to use it? It doesn't make any sense at all when you could have done just as well with a muscle relaxant and an anti-inflammatory.
How many people self-diagnose that they have a migraine headache?
All of them.
There
Every
you
one
go.
of them. And then what they do, and this is the sad thing, is they'll go into the doctor's office complaining of a migraine. I have a migraine. So the doctors right now being frustrated beyond words are simply just going with the flow, and they'll give you whatever you want. Oh, okay. And they write you a prescription for Imitrex. Who cares? Okay, It doesn't make any difference. And that's an unfortunate fact of life. I don't prefer to do it that way personally because it's dissatisfying. But what do? You have to establish the diagnosis first. But then getting back to the sinuses. Okay, just because the maxillary sinuses are the most common doesn't mean that you can't get headaches of a creepier nature. Okay, and these are the ones that defy diagnosis. There are two other sinuses that can cause miserable headache, and you may not figure this out for decades. The sphenoid sinus and the ethmoid sinus. Okay, these are deep inside the skull, and they may only contain enough secretions to fill up a half a peanut. Okay, but when they block up, you just want to blow your head off. It's miserable, agonizing pain, and that's just the way these things go. How do you make the diagnosis? It generally takes sequential. That means more than one MRI or CAT scan before you pick it up, because these things are so small that when they get scrambled up, it doesn't end easily. So the moral of the story is we have to figure out what's wrong first. Then you have a prayer. Then you have a chance. Then you have an opportunity to treat. But just because a headache is bad, just because it's miserable, just because you want to jump off a bridge, does not make it a migraine.
Now, people head into the bathroom, or they're on the job, so they head toward that medical kit that's always in the kitchen, and they take all manner of tablets, whether it be Tylenol, ibuprofen, Excedrin, whatever. What should they be taking?
Okay, excellent question. Generally speaking, you want to pick those medications that will give you relief from more than one possibility. So my go-to medication, if you have to have something immediately, is Aleve. Over the counter, you can go with a generic. It's fine. Aleve is marvelous. Why? Because Aleve is one of the few anti-inflammatories that will cross the blood-brain barrier. What does this mean? It means that if you do have a migraine, it will give you some relief. If you have sinusitis, it will give you some relief. If it's a neuritis or neuralgia, pain, inflammation of nerve origin, it works beautifully. Now, can you take Aleve with Tylenol? The answer is absolutely. They do two very, very different things. One is a pure pain reliever. It's actually a COX-3 inhibitor, believe it or not. Most doctors don't know there is such a thing as COX-3 pathways, but that's what Tylenol does, as the Aleve hits COX-1 and COX-2. So the combination is marvelous in a pinch. What else do you need to do? Keep in your emergency closet two things. One's called N-acetylcysteine, and the other one's called guaifenesin, or generic Mucinex, because you want to take one of each 2 to 3 times a day. It thins out the secretions and allows you to drain these puppies out.
Now, can some of these, quote, pain relievers also have some bad side effects?
Oh, absolutely. If you're looking at the cold preps in particular, those things, the daytime, nighttime, I'm going to get some rest medicines, those things will dry out the secretions and make it harder to clear. They generally make things worse in the long term. Afrin nose spray is something that people sometimes use, but if you don't know to only use it for 2 or 3 days in a row, it will cause damage. Sudafed is another one that will cause damage if used improperly, and I've met very few people that actually understand how to use it properly. So what else can you do? That would be the way to make it happen.
All right, very good. Robin, can you bring us up to date with the stages of life?
Yes, give us a call at 407-679-3337. Our office hours are Monday through Thursday, 8 to 5, and the health store is open during office hours. Our website is stagesoflife.net, and we're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. You can also find us on Facebook at Stages of Life Medical Institute.